Okay, hello. My name's Jody. I am the benefits administrator here at Wood County. I think most of you already know who I am, and I know who you are. So we'll be going over the open enrollment information. I'll quickly go over qualifying events. We'll go through the medical plans that are changing with Anthem and some of the features that they have with their plan. And then I'll talk about the flexible spending plan and then the change in the vision premiums. So first off, we are looking at the open enrollment stuff. So we are holding open enrollment meetings this week. If you attended one, which you are attending today or watching it, you do get wellness points for attending, so you want to make sure that you have signed in. Open enrollment is occurring now through November 11th. November 11th is the deadline for completing and returning your completed enrollment forms. Now this is enrollment for January 1st of 2020, which will carry through the end of the year, so December 31st, 2020. Anything you're enrolling through for now, again, you're enrolling for the entire year. If you want to make changes throughout the year, you must have a qualifying event. A qualifying event would be things like getting married, so you want to add your spouse. Or maybe you got divorced and you want to remove your spouse. You have a child, you want to add your child. Maybe you have coverage elsewhere and now you lost that coverage, so you want to enroll with Wood County. Those are all considered qualifying events. In order to make a change with a qualifying event, you have to fill out the qualifying event form, which is available on the HR website. You must fill out that form and then provide documentation of the event and provide that to HR within 30 days of the event. That is an IRS regulation, so that is what we need to follow. If you are outside that 30 days, unfortunately, you will need to wait until another qualifying event, possibly, or the next open enrollment. Now, if you are adding anybody to your health plan, you do need to provide proof of eligibility. Now, the reason we ask for this is because our health plan, we are self-funded. So what that means is we have an account that we pay for all of your medical bills. So currently WPS, future Anthem, they are the one who processes all of our claims and determines what should and shouldn't be paid for. But Wood County is the one who truly is paying for all of your medical bills. So we want to make sure that everybody that's on our health plan is really eligible to be on the health plan. So you're not adding a domestic partner, maybe a grandchild, maybe a niece or nephew, or your friend that lives down the road. Everybody that's eligible should show proof of eligibility. So if you were adding a spouse, you ask for proof, which is a marriage certificate or your most recent tax return showing that joint filing. If you're adding a child, we ask for a copy of the birth certificate that would show you are the parent, or again the tax return showing that you claim them as dependents. Now you only need to provide this documentation if you are adding someone. If you already have them on your plan, we already have that documentation, so there's no need to provide that. So the first thing with Anthem that I'm going to talk about is their app. They have a mobile app that you can download onto a smartphone, onto a tablet, and the name of this app is called Sydney Health. As you can see on the screen, to me it looks like a little blue and white whale, but it's actually two talk bubbles. There's a white talk bubble and then a blue talk bubble. So again, it's called Sydney Health. Definitely recommend downloading this because the features that this tool has, you can find a doctor, you can receive paperless notifications, you can get an estimate on services, you can also price check on prescriptions. So I've heard that Walgreens is pretty expensive with their prescriptions, where you can compare that to maybe Walmart or CVS or maybe another pharmacy and choose maybe the cheapest option. You can also take health assessments and get tips for staying healthy, and you can also view and track your claims. So you can actually look for a provider now. You would have to look as a guest, and you can go to the Anthem website to do that and select menu and then click on Find a Doctor, and then you are going to choose the plan or the network. So Blue Preferred is the in Wisconsin network. Blue Access is the out of state or out of country network. So when you're looking for a doctor and you are looking as a guest, you can look at the Blue Preferred or again the Blue Access. Now, once you enroll and your insurance is effective on 1/1 and you try to log in and create an account, it's automatically going to pull up the Blue Preferred and Blue Access for you. You don't need to choose that as an option. So with the network that Anthem has with the Blue Preferred, all of the healthcare providers or the major, facilities in Wisconsin are all going to be in network. So Aspirus, Marshfield Clinic, Ascension, Gunderson, Franciscan, Mercy, Mayo, pretty much anything you can think of. Now, the current plan that we have with WPS, the Anthem plan matches the extended plan by 97%. So there might be maybe a chiropractor, maybe a little mom and pop shop or something that won't be included with Anthem that was included with WPS, but Anthem probably has other things or other locations that are included in network. So now we have one network, which is the Anthem network, the Blue Preferred. We don't have the Aspirus network anymore. That is discontinued. So the first plan that we're offering is the traditional PPO plan. Now this is exactly the same as our current plans. So you're looking at a $500 deductible per person, $1,500 for family, and then there's that 90% coinsurance with a maximum out of pocket for deductible and coinsurance of $1,150 for individual or $3,450 for family. This plan still includes all of those same co-payments. So if you go to a physician, a primary physician, you're looking at a $25 copay, a specialist is $50, and so on. So this plan is staying exactly the same. To try not to confuse you, instead of calling it a standard or extended plan, we're calling it the traditional plan. Now I'll cover and talk about the teledoc option and the prescription drug benefit in just a little bit. But the second option that we have is the high deductible health plan. So as it sounds, it's a high deductible plan. So you're looking at a deductible of $2,800 per person or $5,600 for family, and it still has that 90% coinsurance. But now you're looking at an out-of-pocket maximum of $3,800 and $7,600, and there's no copays. So every expense that you have, you are going to pay out of pocket until you reach that $2,800. Once you reach the $2,800, you pay 10% of expenses until you get to the $3,800, which is the out-of-pocket maximum, and then anything after that would be covered at 100%. So unlike our traditional plan, where it's a $500 deductible, and then the 10% coinsurance, you would pay up to $1,150 for individual, but then you have co-payments. So every time you go to the doctor, there's a co-payment, so that can continue to add up. Preventative services are still going to be covered at 100%, not towards your deductible, and that's with both plans. And then the wellness program is still in effect, where you have to complete the 3 core activities to get that discount. So the biometric screening, the health risk assessment, and the health coaching. Now you will get a mailing from Aspirus probably sometime later in November, and that will go into effect for 1/1. It'll tell you all of the changes and everything that are happening with the plan, which we are still awaiting approval on. So the premiums that you're looking at for the traditional plan, and I'm just going to talk about the full-time amounts. A single benefit is $90.42 per paycheck, but with wellness participation, it drops down to $45.21. The family plan is $207.42, but $103.71 with wellness participation. So if you are currently on the standard plan, you're looking at a slight increase in premiums. If you're on the extended plan, you're looking at a decrease in premiums if you move to the traditional plan, which again is equivalent to what we have now with both plans. Now the high deductible health plan, the premiums are going to be a decrease from either plan that you're on now. $72.33 is the single biweekly premium, but with wellness participation it drops down to $36.17. The family amount is $165.93, and with wellness it's $82.97. So it's substantially more. And part of the reason that we did move to Anthem is because we were getting a cost savings that we could then share with our employees by offering this high deductible health plan, and then also with the premiums on the traditional plan. Any questions? No. Okay, so basically you're thinking, okay, which plan is going to be better for me? If you think, do I want to pay more for premiums and less out of pocket, then the traditional plan is going to be for you. If you're okay with paying less premiums and more out of pocket for when you actually need to use the service, when you have medical expenses, you're going to pay $2,800 before the insurance is going to pay for anything, because that's what your deductible is. So if you have an HSA, you have an FSA, and you have funds available, then maybe that high deductible health plan is the right one for you. Now, me personally, I've had multiple appointments with doctors, and I would rather pay the $25 copay than pay the maybe $300 office visit, each crack. So you got to think what's going to be best for you and your family. Now, Live Health Online is the equivalent to the teledoc that we have now. Now, with teledoc, you can currently just call and have a phone call with them, or you can do video. With the Live Health Online, it has to be video. So you either need to have a smartphone where you can do FaceTime or some type of Skype, or you have to have a computer that has a camera available. That's the only way that you can use this service. But it works for the same type of stuff that teledoc does. So cold, flu symptoms, fevers, headaches, sore throat, sinus infection, basically those things that you can get an antibiotic with. Now, same as teledoc, you're not guaranteed to get an antibiotic or prescription, but if it warrants that, then yes, they will prescribe it. With Live Health Online, when you log in, and they have a separate app for this service as well, you can log in and they will have all of the providers available listed with their credentials. So it'll show this doctor went to school here, they have practicing medicine in this location, and you can pick which one you want to see. It's also going to tell you what the wait time is. So maybe you saw or you met with a Dr. A a month ago and you want to see Dr. A again, but there's a 15-minute wait. So Dr. B only has a 5-minute wait, so you could choose that person instead. So you are the one that gets to choose who you want to speak to. They are available 24/7, 365 days a year, and you can call from anywhere. Now, with the traditional plan, it still is a $10 copay. However, with the high deductible health plan, it's a $59 charge. Now, that $59 charge will be in effect until you reach your deductible, and then it's covered at 100%. Your coinsurance does not go into effect with the Live Health Online. With the Live Health Online as well, they offer a psychiatric option. So to talk to a psychiatrist or any mental health things that you would need assistance with. This is a $25 copay for the traditional plan, and it could be a payment of $75 to up to $175 on the high deductible plan. And again, once your deductible is met, then it's covered at 100%. So with the health option, if you call in, you can talk to a doctor right away, but with the mental health option, talking to a psychiatrist, you do need to schedule an appointment. Now, the appointment will probably be maybe anywhere from 3 days to maybe a week, depending on how soon you can get to them and how busy they are. But if you try to go to like a psychologist that's at a facility, you're probably looking at a couple-month wait in order to even get an initial appointment with them. So this could save you some time. And again, it has to be video. So maybe you, maybe your child, somebody in your family, you could set up a computer, lock yourself in the room, not lock your kid in the room, but put your kid in the room, with the video, so that they can talk to the doctor directly without you being a hindrance, possibly. So they can also do medication management for you with the psych evals. They do have that app, as I said, or you can call them, and they have their website. So the next thing is going to be the prescription drug benefit. With Anthem, they have their own prescription drug section, and it's called Ingenio. This is equivalent to the Express Scripts for mail order prescriptions as well as any retail prescriptions. You have to enroll on the Anthem website or, again, through Sydney, that app, and get the order form completed if you want home delivery. So you can get a 90-day supply home delivery versus the 34 or the retail 1-month pharmacy. There's the reduced cost, time savings, and then also you can go to a CVS pharmacy and get a 90-day supply for the 90-day price. So that's the one pharmacy, retail pharmacy you can go to and get the 90-day supply. Otherwise, it's only 1 month.
So are current prescriptions transferring over to this from Express Scripts?
No. So if you have like pre-authorization for prescriptions, you need to have that pre-auth redone after 1/1 with Ingenio or with Anthem. However, if you already have a prescription and you're just getting refills and you just go to the pharmacy to pick it up, you just need to show them after 1/1 your new card. And then the pharmacy will then process it with Ingenio instead of Express Scripts. So any mail order prescriptions you have, yes, you need to make the changes and have your doctor send in the information to Ingenio after 1/1. If it's a retail pharmacy, you're just going to pick up refills. All you need to do is show them your new card after 1/1 when you pick it up. So they do also have a phone number you can call. You can go on the Anthem website, or again, you can track that information on the Sydney app. They do also have health and wellness programs and discounts available. This is all on the Sydney app or on the website. There's certain things like maybe discounts on fitness facilities, discounts for like Jenny Craig, fitness trackers, pet insurance, tons and tons of different things. So I definitely recommend checking out their website to see what other things that they do have available that maybe are not covered under our wellness program. ID cards. Now these will be sent out and you'll receive them sometime probably mid-December, hopefully everything before the first of the year. But your cards, the front of it will include all of your personal information with your name, your member number, your group number, and all that stuff. The back side of the card is going to be all the numbers, the phone numbers that you're going to need. So your member services, your pharmacy questions, coverage while traveling. Any member service numbers are going to be on the back of the card. Now the envelope that these cards will come in is going to be a blank white envelope. So it's going to look like junk mail most likely. So make sure that sometime in December you're not just throwing away that stuff, or somebody else in your family is just throwing away that stuff. Make sure that you are checking those envelopes. Now, if for some reason you do throw those out or you misplace them or you need additional cards, they do offer those free. You just need to order them. You can also download it on the Sydney app or from the website, and you can email it directly to your provider or possibly the pharmacy. Oops, I'm going the wrong way. So with Anthem, our group number is going to be WI2248. Their customer service line is available Monday through Friday from 9 a.m. to 6 p.m. And again, they have their phone number, the Sydney Health app, and their website. If you have questions, you can always reach out to me, or you can contact Anthem directly. So one other thing that we are adding this year is a health savings account. Now, a health savings account is very similar to the flexible spending health account, but it has some advantages. So an HSA, you have to be enrolled in a high deductible health plan in order to contribute into an HSA. So if you take the traditional plan, you cannot contribute into an HSA. The HSA is an account that will belong to you. We are working with the Wood Trust Bank to get these accounts set up. Now, if you have one already set up, we can contribute into that account. We just need to have that account information so that we can contribute or deposit your contributions every payroll. With the HSA, these funds, you can change the contribution amounts throughout the year. With an FSA, you cannot. You enroll at the beginning of the year and that stays throughout the whole entire year. With the HSA as well, this plan stays with you. So if you take the high deductible health plan in 2020, but yet 2021, let's say you go back down to the traditional plan. You can't contribute into the HSA anymore, but you can still use those funds because those are your funds. In addition, if you leave employment with Wood County and you have an HSA, that HSA goes with you. You don't lose those funds. You keep it until you use those funds. With our FSAs, if you don't use it, you lose it. Okay, so that's the difference. Also with an HSA, you can only use what you contributed, what your balance is. With an FSA, you can use the full amount that you've enrolled in on the January 1st, but you're paying in every paycheck to get to that amount that you chose to enroll. With FSAs, if you have TASK and have those debit cards right now, you go to use your card and there's a transaction that gets sent to TASK and it says, yes, that's an eligible medical expense, and it approves it and lets you go through it with that transaction. Now, with an HSA, you get a debit card, but you now are the holder of that account and you're responsible for making sure that those purchases are qualified medical expenses. So if I have my HSA debit card and I decide to go to Walmart and I'm going to buy a pair of boots and bananas and whatever, well, those boots most likely are not going to be considered a medical expense. Maybe if they're orthotics, but probably not. Now, it'll let me purchase it because there's nobody regulating it. But you, as the account holder, need to keep track of those receipts, hold on to those receipts, because if you ever get audited, you need to show proof that you used your funds from your HSA for those qualified medical expenses. Okay, so that's to me, that might be a downfall. Now, you don't have to participate in the HSA if you take the high deductible health plan, but that is an option for you. If you choose to take the flexible spending health account, you can still do that too. But you can't have an HSA and an FSA health plan. So if you take the HSA and you have funds still remaining after the first of the year in your FSA health plan, those funds will get moved to what is called a limited purpose FSA. And the limited purpose account can be used for dental or vision expenses because your HSA is only medical. Now, if you're not taking the high deductible health plan, you're not doing HSA, you can still do the health FSA, you can still do the dependent FSA, and that's fine. You won't need the limited purpose FSA. Does that make sense to everybody? It's a little complicated. So with vision, the only thing that's changing is the the premiums. So for those of you that have been here quite a few years, we used to have the medical and the vision plan all as one. And then a couple years ago, they decided to break those out. So we had the medical plan and then we have the vision plan. The premiums were never really consistent. So the single coverage was maybe paid at 42% and the employee and spouse was maybe 47% and so on. So what we've done is made it consistent now, and the county will pay 40% of the premium, no matter what tier that you choose. So you're responsible for 60%. So that's the only change that's happening with the vision. I just want to make sure everybody's aware of that, so when they get their paychecks and they see that there's an additional amount or a decreased amount, that you know why. So just to recap here, The forms are all due by November 11th. Your new premium rates for health, dental, and vision, those will begin on the December 5th paycheck because we pay our premiums 1 month in advance. For short-term disability and health savings account, as well as the flexible spending accounts, those will all start on the January 3rd, 2020 paycheck. So you will notice also with the open enrollment forms, there is nothing on long-term disability or life. Those coverages will remain the same unless you choose that you want to make changes. And those changes actually can be done anytime throughout the year. You don't need a qualifying event, and you don't need to do it during open enrollment. If you're not enrolled in them and you'd like to enroll, or you'd like to increase your coverage for life insurance, you have to fill out an evidence of insurability form, which is basically a medical questionnaire that we'll send to Mutual of Omaha. Their underwriting team will review it and either approve it or deny it. So as long as you're in good health and you're filling out these forms, there should be no reason that it would be declined. And also, if you are interested in canceling your long-term disability or life insurance, you can do that at any time for any reason. All you need to do is provide me something in writing that says you want to cancel, and it has to be the first of a month. So you send me an email, Jody, I want to cancel my long-term disability effective 1/1/20, and I'll take care of it. So if you have questions after this, you can always reach out to me. I'm here located at the courthouse. You can email me or give me a call. If I'm not available, you can always check with one of my coworkers. The other opportunity for you to call is the Horton Group. Jessica Lamar is our contact, so you can always reach out to her as well. And then also you can contact Anthem after the first of the year. If you try to contact them now, they probably won't have any information for you because our plan is not active yet.